Introduction to Mindfulness. Dr. Anne-Marie Tchaikovsky. Mindfulness. An Introduction. Vocal Health First Aid. The Past. Mindfulness means paying attention, on purpose, in the present moment, non-judgmentally. Kabat-Zinn. Historical context. Buddhism. Jon Kabat-Zinn and development of MBSR. Clinical research overview. Areas of research. Prevalence. MBCT. Learning mindfulness. Yesterday is history. Tomorrow is a mystery. Today is a gift. That is why it is called the present. Morse Earl. Rationale for learning mindfulness. Contents of MBSR, MBCT, MBI courses. Mindfulness exercises, psychoeducation, group work, discussions, practicals, types of mindfulness exercises, focused attention, open monitoring. Problems learning mindfulness. Mindfulness and music. Mindfulness and music research overview. Predominantly in music performance anxiety. Other mindfulness research. Mindfulness application suggestions for vocal health. MPA. Extraneous body. Tension. Psychological difficulties. End of section. Tchaikovsky, A.M. L. and Amp. Greasley, A.E., 2015. Mindfulness for Singers. The Effects of a Targeted Mindfulness Course on Learning Vocal Technique. British Journal of Music Education. 32. 02. 211-233. https://doi.org/10.1015/S02650517150000145. Tchaikovsky, A.M. L. Greasley, A.E., and Amp. Alice, M. 2020. Mindfulness for Musicians. A. Mixed Methods Study investigating the effects of 8-week mindfulness courses on music students at a leading conservatoire. Musicae Scientiae. https://doi.org/10.1177/1029864920941570. Diaz, F.M., 2011. Mindfulness, Attention, and Flow During Music Listening, an Empirical Investigation. Psychology of Music, 41, 1, 42-58. http://palm.sagepub.com/content/early/2011/030573114151444. Dora, C. Conforti, S. and Amp. Guzwell, A. 2019. Exploring the Influence of Body Awareness on Instrumental Sound. International Journal of Music Education. 37. 2, 311-326. https://doi.org/10.1177/ 0255761419827342. Newton, J.Z. 2015. Musical Creativity and Mindfulness Meditation. Can the practice of mindfulness meditation enhance perceived musical creativity? International Journal of Transpersonal Studies. 34. 1-2, 172-186. https://doi.org/10.24972/ige.2015.34.1-2.172. Stein, B.J.M. Stein, M.H. Marie, D.J.F., and Amp. Ponebianco Warrens, C. 2016. Psychological Skills and Mindfulness Training Effects on the Psychological Well-Being of Undergraduate Music Students, an Exploratory Study. Journal of Psychology in Africa, 26, 2, 167-171. http://dx.doi.org/10.108/143302237 2016.11639006. Singers are human too. Line Hilton. Singers are human too. Main systems of the human body and their functions. With Line Hilton MSc PAM, B Mus Ed. Jazz, CHYP. Vocal health first aid. Body systems. Circulatory, cardiovascular. Nervous, neurological. Digestive. Excretory, urinary. Endocrine. Reproductive. Integumentary. Respiratory. Lymphatic, immune. Skeletal. Muscular. Circulatory system. Systemic plus pulmonary. Electrolytes and hormones. Removes carbon, heart, lungs, arteries, veins and amp, dioxide and capillaries and waste products. Lymphatic system. Delivers oxygen. Digestive system. Mouth. Rectum and anus. Esophagus. Stomach. Plus the pancreas, gall bladder and liver. Small intestine. Large intestine. Respiratory system. Extends from the bronchioles, nose and mouth, lungs, pharynx, alveoli, larynx, diaphragm, and trachea, bronchi, intercostal muscles. Endocrine systems. Produced by glands and organs. Hormones are chemicals that regulate metabolism, growth and development, tissue function, sexual function, reproduction, sleep, mood, psychological. Not considered a system as such but relevant to singing and performing. Considering the whole body. Line Hilton. Considering the whole body. How performing arts medicine can help the singer. With Line Hilton MSc PAM, B Mus Ed. Jazz, CHYP. Vocal health first aid. What is performing arts medicine? A growing field of medical and health specialists and practitioners who work with performing artists. Who is involved? A wide range of medical and health clinicians, general and specialist doctors, physiotherapists, osteopaths, registered nurses, psychologists, chiropractors, sports therapists and so on. Doctors, general and specialists. A bit about moi. Type to enter a caption. Singer and instrumentalist. General nurse, B Mus Ed. Jazz, MSc PAM. Singing teacher. And vocal health coach. Resilience coach, RA master practitioner. Rapid transformational therapist, RTT, CHYP. BAPAM educational trainer. MHFA. What PAM practitioners do. We focus on how health and well-being impacts the artist and their art. How the artist's job impacts their health and well-being. It's a bit like sports medicine. But not really. Generally single field. Athletes have limited workspan, usually retiring in their 30s. Focus on competitions, races spaced throughout the year. Daytime work. Will always have a trainer, coach to help them develop and maintain fitness. Injury, a given, attitude. Multidisciplinary teams common. At elite level, e.g. doctor, physio, massage therapist, nutritionist, S&AMP, psychologist. Who do PAM practitioners look after? Anyone in the performing arts. Mind, BODY1. DRJENEVORA. Williams. Mind, Body 1. How emotions drive our behavior. Dr. Genevora Williams. Vocal health first aid. Emotions and how they drive our behavior. How can understanding our emotional responses promote and maintain good health? Innate emotional responses. Arousal, excited, positive, valence, attractive, negative, valence, aversive, arousal, calm. These responses are crucial for our survival. Emotions and how they drive our behavior. Valence equals the degree of pleasant or unpleasant. Pain equals punishment, withdrawal or freeze. Pleasure equals reward seeking and approaching. Negative emotion prevents learning. Working memory is taken over when in fear or anxiety. Positive emotion assists learning. Visceral response from pleasure increases neurotransmitters in the brain: dopamine, serotonin, norepinephrine. Emotions, the mind-body link. Interoception equals our awareness of our internal functions: heartbeat, blood pulsing, gut movements. We may be aware of these responses before we have cognitively processed the information. This is gut feeling, e.g., lust, disgust, sadness, joy, shame, humiliation. Emotions, the mind-body link. Feelings become labeled as emotions. These become learned patterns in the brain. All new information is matched with existing patterns in the brain. If it fits, we assume it's the same, or very similar. We view the world through predictions and confirmation bias. We link our experiences and bias with beliefs, cognitive fusion. Everything about helping the voice user is to do with removing fear and providing a safe place for change. Listen, respect, empathize, reassure. End of section. Mind, Body 3. Drjenevora Williams. Mind, Body 3. What emotions can do to the body and vice versa. Dr. Jenevora Williams. Vocal health first aid. Fear response will cause changes in the body and the mind. Affective disorders equals mood changes, anxiety, worry about future performance. Cognitive symptoms, mind, equals racing thoughts or forgetting words. Somatic disorders, body, equals sweaty, shaky, vomiting. Body response, breathing and heart rate. Exhaling slows the heart rate. Inhaling speeds the heart rate. Controlled, long exhalations, counting, will calm the body and calm the mind. Fear response will cause changes in the body. What about the voice? Fight, flight is getting us ready for quick response. This means holding everything. Holding patterns equals unnecessary tension. Unnecessary tension equals inefficient vocal function. If anything is held, or fixed, it will cause a problem for the singer in the longer term. Fear response will cause changes in the body. What about the voice? Singing is a dynamic system. Breath is moving and breath pressure is constantly changing. Laryngeal muscles are moving and interacting with each other. Everything needs to be flexible and responsive. This is at a really subtle micro level as well as things we can see and feel. If anything is held, or fixed, it will cause a problem for the singer in the longer term. Fear and anxiety, foreground and background. Background equals underlying anxiety, mood, beliefs. Edgy, tense, cheerful, enthusiastic, down. Underlying states or feelings, may or may not be conscious. Chemical and visceral representations in the body. Remember interoception? Relation between these and our motivational drivers equals intimate. Can be brought on by physical state. Repetitive pointless labor. Runner's high. Mulling over a problem. Euphoria of being in love. How do we adapt these anxiety responses? Calming the mind to help changes in the body. Accept that some degree of anxiety is normal and will always be part of our performing. Accepting thoughts as they arise, not confronting them. Thoughts are just thoughts, they don't define us. Feed the positive in our responses. Neglect the negative. Water the seeds we choose, and leave the others. For a healthy attitude to performing, be generous towards all other performers. Enjoy their successes. Empathize with them for their mistakes. See the audience as your friends. Practicing a calm state of mind is as important as practicing technique. All our reactions and responses have senses, feelings, and emotion driving them. There is no such thing as rational thought. Emotions and feelings may be wrong. Cognitive fusion, senses, may not be accurate representations of our environment. Senses and feelings may not be accurate representations of ourselves. We can change our responses. The mind-body link. We can calm somatic responses with cognitive adjustments. We can calm ITIVE responses with somatic processes. We can be helped to change what can be changed. We can learn to accept what we can't change. Our vocal health first aider can help us to know the difference. Everything about helping the voice user is to do with removing fear and providing a safe place for change and healing. Listen, respect, empathize, reassure. End of section. Functional Anatomy 1. Dr. Williams. Functional Anatomy 1. Body Balance. Dr. Jenevora Williams. Vocal Health First Aid. Our perceptions of our body are distorted. Most of the parts of the body that we use for voice, we can't actually feel. What's the point of naming the parts? Labeling diagrams won't help you to understand interactions. How does it relate to the rest of the system? What are the existing patterns for other functions? What does it feel like? What does it sound like? How will this inform knowledge of vocal health? Begin with the backbone. Every part of the spine has a direct connection to voice. Every adjustment of the spine will affect vocal production. Cervical, scalenes plus some rib articulation. Thoracic, main rib articulation. Lumbar, abdominal muscle attachments. Sacrum, pelvic floor muscle attachments. Resist and stabilize action of abdominal muscles. TB, DG, M. Core muscles of the torso. All interconnected. Activity in one will trigger activity in the others in order to maintain stability in the system. Function, stability and breath management. All interconnected. Overactivity in one will compromise function in the others. End of section. Functional Anatomy 5. Dr. Jenevora Williams. Functional Anatomy 5. The larynx. Dr. Jenevora Williams. Vocal Health First Aid. The larynx. Location and surrounding structures. The larynx. Cartilages. Muscles of the larynx, both inside and outside. Prime function. Intrinsic equals airway protection, cough, swallowing. Extrinsic equals swallowing. Remember that the larynx is primarily programmed to squeeze shut. Making sound requires this instinct to be overridden. Within the larynx, what can be changed? Onset, aspirate, glottal, simultaneous or creak. Pitch changes. Loudness and brightness. The sound source, not including vocal tract acoustics. Vocal register. Vibrato. Voice qualities such as breathy, pressed, creaky. All of these are dependent on the behavior and interaction of the intrinsic laryngeal muscles. Laryngeal efficiency. Subtle interplay between three factors. Subglottic pressure. Transglottic airflow. Glottal resistance. High subglottic pressure. Increased closure with high airflow equals pressed plus airy. Trauma. With low airflow equals pressed plus loud. Belt. Low subglottic pressure. Gentle closure with high airflow equals breathy. Whisper with low airflow equals quiet and clear. End of section. Functional Anatomy 3. Dr. Jenevora Williams. Functional Anatomy 3. Breathing and pressure. Dr. Jenevora Williams. Vocal Health First Aid. Breathing for singing. Breathing for singing. Lungs full. Lungs empty. Middle ground. Breathing for singing. Subglottic pressure equals CmH2O. Conversational speech equals 5 to 15. Singing equals 15 to 30. Occasionally more. Lungs full equals plus 40. Lungs empty equals minus 40. Breath management over a single exhalation equals continuously variable. Breathing for singing. Subglottic pressure equals CmH2O. Conversational speech equals 5 to 15. Singing equals 15 to 30. Occasionally more. Lungs full equals plus 40. Lungs empty equals minus 40. Breath management over a single exhalation equals continuously variable. And that's not to mention pitch changes, vowel changes, loudness, consonants, etc. All needing subtle variations in breath pressure. You can't control it. You can only establish a flexible and responsive system. And trust your body to manage the breath without interference. More on breathing, efficiency, effectiveness, and economy. Most people get reward from working hard. When they grasp an idea, it is then enthusiastically employed until it doesn't feel so unusual. Then it's done a bit more, and a bit more. Efficiency is about reducing effort levels to the most economic. The most economic will actually feel like less, as it is using existing systems and patterns effectively. End of section. Functional Anatomy 2. Dr. Jenevora Williams. Functional Anatomy 2. Head and Neck. Dr. Jenevora Williams. Vocal Health First Aid. Balance of the head and neck. Just where is that atlanto-occipital joint? Balance of the head and neck. Just where is that atlanto-occipital joint? Balance of the head and neck. Just where is that atlanto-occipital joint? Balance of the head and neck. Adjacent muscles will be co-opted for functional efficiency. What is the most effective way to prevent gripping or fixing? Small and gentle movement, unrelated to vocal function. End of section. Functional Anatomy 6. Dr. Jenevora Williams. Functional Anatomy 6. The vocal folds. Dr. Jenevora Williams. Vocal Health First Aid. Vocal folds or cords. Ventricular fold, FAL. Say fold, layers through vocal fold. Squamous epithelium, Reinke's space. Vocal fold layers. Squamous epithelium, near to mucosal layer. Good at repairing surface damage. Wet, Reinke's space. Jelly. Wobbles, helps mucosal wave. Vocal ligament, firm, gives structure. Lamina propria. 3 layers. All have differing stretch and amp, wobble properties. Vocalis, thyroarytenoid, muscle, shortens or bulks up. Vocal registers. A register is defined as a sequence of pitches in which the vocal fold mode of vibration remains consistent. There will be an overlap of pitches in which more than one register is possible. There will be a range of pitches in which one register is more efficient than another. I, D, V, M, S, D. Vocal registers M0, M4. M0 equals fry or creak. Sometimes you can't tell the difference between M1 and M2. M2 equals falsetto, thin fold, head in a female mix or a male head. M3 equals whistle voice, although the singer male head voice equals light M1 always knows as they feel different. Female MT mix equals light M1. It doesn't matter if it female classical mix equals heavy M2. Sounds good and feels easy. Gray area equals relationship between laryngeal muscles. M1 equals modal, speech, thick fold, chest. Gray area equals acoustic effects. End of section. Tension Assessment 1. Stephen King. Tension Assessment. Stephen King. Vocal Health First Aid. Tension. What is it? Tension. Mid-16th century, as a medical term denoting a condition or feeling of being physically stretched or strained, from French, or from Latin tensio, and from tendere, stretch. Tension. What is it? Tension is an imbalance in tension-generating sites in any muscle or muscle group, holding the muscle or muscle groups in a permanent or semi-permanent state of contraction. Muscle tension. Dysphonia. Tension can be a pathology in its own right. Muscle tension dysphonia, MTD, primary, secondary cause. Primary MTD. Deregulated activity of the paralaryngeal muscles is considered the proximal cause. However, the central origin of this aberrant laryngeal muscle activation is unclear. Overdiagnosed with up to 80% of all endoscopy, in the absence of VF pathology, leading to an MTD diagnosis. The problem with posture. What is the perfect posture? Is poor posture the cause of the problem? Or the problem the cause of poor posture? Posture. Ergonomic. Furniture measures no helpful link to change pain patterns by fixing posture. Reading MRI scans cannot determine whether someone will have pain based on any postural differences in their spine. The take-home tension may be its own pathology, but it might be a symptom of something else. Posture has little peer-reviewed data to correlate it to pain. End of section. Vocal assessment methods. Chris Johnson. Vocal assessment methods. The initial assessment. Vocal health first aid. Why are we here? To provide immediate help until specialist help is accessed. History taking. 1. Start with the problem. History taking. 2. Check general recovery times. I'll be fine tomorrow. Bit longer for me. History taking. 3. Recent change to function. And now, straight to singing. With caution. Not feeling, sounding hoarse. Not postoperative. Nothing tiring. It provides you with information. Next up, movement series. End of section. Vocal health first aid. Introduction. Stephen King. Dr. Genevora Williams. Vocal health first aid. The modules. Vocal health first aid. Introduction. The mind, body, functional anatomy, assessment methods, pathology, hormones and aging, practical advice, assessment, end of course quiz, questions about each section, pass rate 65%, final assessment registration, interview, pass equals qualified vocal health first aider, not yet, achieved equals opportunity to redo the pathway with or without an additional tutorial. What is first aid? hse.gov.uk. First aid means a. In cases where a person will need help from a medical practitioner or nurse, treatment for the purpose of preserving life and minimizing the consequences of injury and illness until such help is obtained, and b. Treatment of minor injuries which would otherwise receive no treatment or which do not need treatment by a medical practitioner or nurse. What is a vocal health first aider? An understanding of vocal health and the factors that can affect vocal well-being. Practical skills to spot the signs of a range of vocal dysfunction and imbalance. Knowledge to help someone towards recovery by a. Guiding them in self-management, or b. Passing them on to further support, whether that is specialist vocal rehabilitation coaching or clinical treatment. An understanding of how to prevent vocal health issues from occurring in the workplace. Holistic overview of health and well-being. Background, diet, exercise and sleep. Other illness, injury, mental health. Holistic overview of health and well-being. Foreground, singing, speaking, habits and behaviors. Workplace demands. Why do problems happen? Overview, overloading the system. Unexpected challenges of the workplace. Costume, lighting, amplification, distraction, cleanliness. Vocal technique has to be reliable to cope with these. Why do problems happen? It's always a combination of factors. If a singer says that they have a problem, they have a problem. If you don't know what it is, or can't find it, don't say, "There's nothing wrong." That won't reassure them, it just makes them think it might be all in their head. Why do problems happen? It's always a combination of factors. It's your job to keep looking or keep referring until the singer says the problem is solved. Vocal problems rarely have a single cause. All voice problems have a psychological, anxiety aspect. Things to bear in mind. The singer may not have a reliable or realistic understanding of vocal function or technique. If they are scared and anxious, be very careful with their belief systems. Don't expose them or trample on them. Even just making a sound for you can be terrifying. They may be scared of hurting themselves. Vocal health. What's the story? Loss of or gaps in range. Loss of vocal flexibility. loss of stamina and vocal fatigue, loss of ability to sing either loudly or quietly, changes to vibrato, faster, slower, change in resonance, may sound duller or shriller. Vocal health. What's the story? Loss of or gaps in range, loss of vocal flexibility, aching or soreness in the vocal tract, loss of stamina and vocal fatigue, aching or soreness in external muscles, loss of ability to sing either loudly or quietly, voice quality affected following use, changes to vibrato, faster, slower, change in resonance, may sound duller or shriller. Increased recovery time between engagements. Vocal health. Barriers to recovery? Singer's schedule. Too much, unavoidable, work. The need for secrecy around having a problem. Compliance and commitment. Financial pressure. Emotional, psychological. Change is difficult, threatening. It can mean letting go of belief systems. Wrong diagnosis? End of section. Grading the voice. A practical workshop using GRBAS. Lydia Hart. Grading the voice. A practical workshop using GRBAS. Vocal health first aid. Session content. What is GRBAS? Parameter definitions. The benefits and limitations of GRBAS. GRBAS practice, listening to voices. GRBAS. Hirano. 1981. Widely used perceptual rating of the voice. 5 parameters. 4 levels of rating. Grade. 0 equals normal, roughness, breathiness, asthenia, strain. 1 equals mild, 2 equals moderate, 3 equals severe. GRBAS. Grade. Degree of hoarseness of voice abnormality. Rating cannot be lower than any rating for RBAS, i.e. must be equal to, or higher, than the other ratings. GRBAS. Roughness. Impression of. Irregularity of vocal fold vibrations corresponds to irregular fluctuations in fundamental frequency and or the amplitude of the glottal source sound. Croaky, creaky, raspy, gravelly. GRBAS. Breathiness. Impression of the extent of air leakage through the glottis related to turbulence. GRBAS. Asthenia. Weakness or lack of power in the voice related to weak intensity of the glottal source sound and or lack of higher harmonics. Thin, lacking power, body, strength. Not just volume. GRBAS. Strain. Impression of hyperfunctional state of phonation related to abnormal high fundamental frequency noise in high frequency range and or richness in high frequency harmonics. Constricted, squeezed, forced, pushed, pressed. GRBAS. Why is it helpful? Fairly universal. Helps to develop perceptual skills by giving clear parameters. Helps to objectify a subjective assessment. Specific words used to describe voice are often vague and open to interpretation. Husky, hoarse, raspy, croaky, forced, etc. GRBAS. What it doesn't evaluate. Pitch, plus or minus register, volume, intonation, breath flow, consistency, breaks, e.g. pitch fluctuations or aphonic breaks, tremor or spasm. Diplophonia. Included in roughness. GRBAS. Take-home messages. Grading voices using GRBAS is a high-level skill that takes time and experience to cultivate. GRBAS can be used as a guide. You don't have to do a full grading. Think beyond GRBAS, it's not the full picture. End of session. Speaking voice assessment. Lydia Hart. Speaking voice assessment. What can go wrong with the speaking voice? Vocal health first aid. Session content. Why the speaking voice is relevant. Types of speaking voice disorders. Relationship between organic and functional disorders. Methods of assessing the speaking voice. What to do when you are concerned. We breathe and we voice, the first 2 activities of our life. Spoken voices feel like an extension of our personality, flowing effortlessly out of our heads and hearts, our thoughts and feelings. Christina Shewell SLT. Voice Work, Art and Science in Changing Voices. Why does the speaking voice matter? We speak far more than we sing. When we are singing, we think about technique, breath, resonance, vocal tone, body use, tension, etc. How many people can say they pay the same attention to their speaking voice? Speaking and singing are different, but because we pay less attention to the way we use our speaking voice, we are more likely to be using it in an inefficient way. Issues with the speaking voice may have a knock-on effect on the rest of the functions of the larynx, including singing. Types of speaking voice disorders. Not disordered. Examples: vocal creak, monotony, de-energized voice, inappropriate pitch, poor breath flow, breath holding, laryngeal guarding. Types of speaking voice disorders. Examples: muscle tension dysphonia, aphonia, psychogenic, or hyperfunctional, puberphonia, falsetto, aphonia with upper respiratory tract infection. Types of speaking voice disorders. Examples: neurogenic equals nerves, vocal cord, paresis, weakness or palsy, paralysis, spasmodic dysphonia, vocal tremor. Structural equals tissues, nodules, cysts, polyps, edema, granuloma, hemorrhage. Types of speaking voice disorders. Types of speaking voice disorders. Types of speaking voice disorders. Secondary equals organic, primary equals functional. Types of speaking voice disorders. Types of speaking voice disorders. Primary equals organic, secondary equals functional. Other laryngeal disorders. Examples: pain, ache versus stinging, burning, globus, throat clearing, chronic cough, tightness, constriction, inducible laryngeal obstruction. Assessment of the speaking voice. Subjective measures, questionnaires and rating scales. Voice Handicap Index, VHI, VHI-10. Vocal tract discomfort scale. Reflux symptom index. Rate your voice on a scale of 1–10 feet. Voice handicap index 10. And GT, 11 equals abnormal. Rosen, C.A., et al. 2004. Quote: Development and validation of the Voice Handicap Index 10. Laryngoscope 114. 9, 15,491,556. Assessment of the speaking voice. Objective measures. Case history taking. Perceptual assessment of the voice. GRBAS. Palpation. Assessment of breath pattern, tension levels, posture, mood, etc. Assessment of the speaking voice. Instrumental and acoustic assessment. ENT. Endoscopic evaluation of the larynx. Video stroboscopy. Laryngograph, spectrogram, etc. Measures of amplitude, frequency, consistency, air pressure, etc. Assessment of the speaking voice. What to do when you think there might be a problem. 1. Take a history. How long has this been happening? When did it first start? Initial trigger. When does it happen? Constant or occasional? What triggers it? Certain activities. Environments? Trajectory. Better, worse, or the same. Aim. To determine relevant factors in the voice, e.g. timescale, triggers, and variability. Assessment of the speaking voice. What to do when you think there might be a problem. 2. Establish relevant symptoms, medical history. Pain, dryness, globus, tension, fatigue, tightness, coughing or throat clearing, reflux, any heartburn, indigestion, taste of acid, burning throat, RSI, other airway problems, e.g. nasal congestion, asthma, etc. Aim. To determine relevant factors in the voice and guide voice care advice. Assessment of the speaking voice. What to do when you think there might be a problem. 3. Perceptual assessment of the voice, body and breath. What does the voice sound like? GRBAS as a guide. Is there visible or audible tension, holding patterns? Is the voice constant or intermittent? How does the person seem emotionally? How does the speaking voice compare to the singing voice? Aim. To help determine severity of problem and hypothesis for underlying problem. Assessment of the speaking voice. What to do when you think there might be a problem. 4. Onward referral. Guidelines state persistent hoarseness for more than 3 weeks, see GP. GP will refer to ENT if concerned, particularly if any red flags. Assessment of the speaking voice. What to do when you think there might be a problem. What can you responsibly do in the meantime? As a vocal health first aider, you can encourage good voice care, provide advice and reassurance, continue to work with the voice if it feels safe and comfortable, and is not having a detrimental effect on the voice. End of session. Mind, VODY2. DRJENEVORA Williams. Mind, Body 2. Stage fright. Why do we get it and what can be done? Dr. Genevora Williams. Vocal health first aid. Fear and anxiety foreground and background. Foreground equals stage fright, music performance anxiety. Why do we get nervous and what can we do about it? When does it happen? When we think we are being judged. When does it not happen? When we think we are in control. Practicing. Sing through for fun. Performance outcomes. What makes it worse? Autonomic nervous system. Automatic. No control. Regulates body functions, e.g. heart rate, digestion, cell repair. Also emotional responses, e.g. embarrassment, fear, attraction. Autonomic nervous system. Parasympathetic or rest and digest. Everyday activities. Process. Sing food. Repair and healing. Immune system. Sympathetic or fight and flight, or freeze. Emergency response. Energy in muscles. Cooling off. Focus attention. Stop everything else. End of section. Tension Assessment 2. Stephen King. Tension Assessment 2. Stephen King. Vocal Health First Aid. Philosophical point. Stop naming tension. Only medics can diagnose. Fix it, don't point it out. Tension palpation. We cannot reliably palpate it. Tension is subjective. What is the objective measure? Tension. Knowledge through movement. Interaction. Audible changes. Reported changes in sensation. Tension. Test and retest. Test. Provide a measure. Intervention. Coaching. Manual therapy. Retest. The take home. Movement is medicine. Motion is lotion. End of section. Movement Series 1. Chris Johnson. Movement Series 1. Moving the head. Vocal health first aid. Movement. Maladaptions and AMP. Compensations. How did that feel? Fine. Making a discovery. Dysphonia is generally associated with altered extralaryngeal muscle activity. Modifications in postural control that emerge in these cases have an important role in the genesis and maintenance of dysfunctional dysphonia. Ooh, that felt good. The wheels fell AWF. Postorographic analysis in patients with dysfunctional dysphonia before and after speech therapy, rehabilitation treatment. Nassi et al., 2012. Maladaption. The discovery of maladaption. An adaptation that, whilst reasonable at the time, has become less and less suitable and more of a problem or hindrance in its own right. Wikia.org. Movement, the head, vocal assessment, movement protocol, articulation, tongue and AMP, jaw movement, vocal assessment, movement protocol, articulation, tongue and AMP, jaw movement, move head, left, right, figure of 8. Vocal assessment, movement protocol, articulation, tongue and AMP, jaw movement, move head, left, right, figure of 8, raise chin 20 degrees, build your assessment, take notes, and keep scores. Use a note system to record the singer's scores, thoughts, and to jot down your observations. They'll come in handy down the line. All other movements in the series will be added to create a fully rounded assessment protocol. End of section. The Biopsychosocial Model. Stephen King. Vocal Health First Aid. Biopsychosocial. What is it? Comprehensive overview of dysfunction. Holistic. Has to be considered for healing. Our understanding works in conjunction with the biomedical approach. The philosophical basis of vocal health education. Biological. Tissue damage. Genetic vulnerability. Drug effects. Psychological. Mental health. Family relationships. Social skills. Psychological. The singer with a problem will be feeling very anxious and vulnerable. The singer will be frightened of people finding out and therefore getting a bad reputation. They will be feeling guilty about doing something wrong. They will feel responsible even if they've done nothing wrong. Sociological. Peers. Family circumstances. Job circumstances. Sociological. The singer may not have a reliable or realistic understanding of vocal function or technique. If they are scared and anxious, be very careful with their belief systems. Don't expose them or trample on them. Even just making a sound for you can be terrifying. They may be scared of hurting themselves. The take-home. Managing dysfunction and pain must have biopsychosocial considerations. End of section. Movement Series 3. Chris Johnson. Movement Series 3. Stability and Energy. Vocal Health First Aid. Recap. Adding to the story. History plus singing assessment. Compensations and maladaptions. Movement Series 1 Head. Movement Series 2 Arms. Ellipsis 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 dot dot. Movement, stability and amp. Energy. Relax. Energize. Distract. Vocal assessment. Movement protocol. Swaying. Loose. Floppy arms. Vocal assessment. Movement protocol. Swaying. Loose. Floppy arms. Shaking fist. One or both. In or out of sync. Vocal assessment. Movement protocol. Swaying. Loose. Floppy arms. Shaking fist. One or both. In or out of sync. Running arms. Allow arms to shake the body. Voice. Vocal assessment. Movement protocol. Swaying. Loose. Floppy arms. Shaking fist. One or both. In or out of sync. Running arms. Allow arms to shake the body. Voice. Marching. Exaggerated. End of section. Movement Series 2. Chris Johnson. Movement Series 2. Moving the arms. Vocal Health First Aid. Recap. Adding to the story. History plus singing assessment. Compensations and maladaptions. Movement Series 1 Head. Ellipsis 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 ellipsis. Movement. The arms. The arms and the breath. Even a small movement of the rib cage wall can displace a large quantity of air. This is because the rib cage is in contact with a large portion of the lungs, so that its movement has a major influence on the movement of air. Thomas J. Hickson. Respiratory function in singing. The arms and the breath. Studies have demonstrated that these individuals speak WITH both decreased LV initiations and terminations. Only decreased LV initiations, only decreased LV terminations, and larger LV excursions, characterized by both increased LV initiations and decreased LV terminations. The impact of glottala configuration on speech breathing. Murray et al., 2017. The arms and the breath. The studies suggest that the ribs and the shoulder joint demonstrate synchronous interaction. Characteristic movement of the ribs, thoracic vertebrae while elevating the upper limbs. Tachihara, Hamada, 2019. Vocal assessment. Movement protocol. Rolling shoulders. Continually backward. Vocal assessment. Movement protocol. Rolling shoulders. Continually backward. Arms in the air, straight above head, stood proud. Vocal assessment. Movement protocol. Rolling. Shoulders, continually backward. Arms in the air, straight above head, stood proud. Combo, for open ribs and flexibility. Next up, stability and energy. End of section. The role of the laryngologist in AMP, the voice clinic. Natalie Watson. The role of the laryngologist in AMP, the voice clinic. Natalie Watson MAFRCS, ORLHNS. Vocal health first aid. What's a voice clinic? A clinic specifically set up to help professional voice users. Staffed by ENT surgeon, SLT, singing teacher, voice coach, osteopath psychologist. How do we diagnose pathology? The patient tells us. VHI. Listen to the patient. GRBAS. Laryngeal examination. Laryngostroboscopy. Specialist tests. Computer analysis of voice recordings. What happens in voice clinic? Medical history. Presenting complaint. Inc. Drug history. Allergies. Vocal history. Vocal hygiene. Style of singing. Change in style. Wide range of styles. Training. Warm-ups. Schedule of rehearsals. Performances. Specific vocal demands in this role. Psychological issues. Why are you here now? Vocal hygiene. The extent to which a patient looks after their voice. Smoking. Alcohol. Hydration. Throat clearing. Steaming. Reflux. Abusive behaviors. Medications. Decongestants. Cough medications. Antidepressants can be drying. Antihistamines. Dehydrating. Check with the pharmacist. Contraceptive pill significant benefits. Steroid nasal spray. Rhinitis, e.g. Flixenase, vocal fold irritation, dryness. Aspirin, increase possibility of hemorrhage. Antibiotics, can lead to secondary fungal infections. OTC Strepsil, Vocal Zone, anesthetic throat spray. Common presentations. Vocal fry, pitch abnormalities. Diplophonia, Pesagio, transition difficulties. Rough, strained, weak. Breathy, breathing, stridor, squeezed. Head and neck examination. Oral, neck, pain, tension, spasm, may indicate primary or secondary muscle tension. All mucosal surfaces of H and AMP, N. Mucus, membranes. Laryngeal examination, dental mirror, flexible or rigid stroboscopy, perceptual slow motion view by manipulating light. Mucosal wave. Traveling wave occurs relative to the epithelium and superficial lamina propria over the deeper lamina propria and thyroarytenoid muscle. E.g. lower lip lesion. Drive chest voice higher than you should before flipping into head voice. End of section. Hydration and reflux. Duncan Rock. Hydration and reflux. Duncan Rock. Vocal health first aid. Hydration. Why is hydration important? Systemic, whole body, hydration. Thin mucus on vocal folds. Allows for optimal vibration with minimal effort. External hydration. Steam room, hot shower, head over a kettle etc. Only way getting moisture directly onto the vocal cords. Internal hydration. Linked with nutritional status. Systemic hydration through consumption of fluids. No food or drink comes into direct contact with vocal cords. How much water? 1 milliliter of water per calorie burned. Impossible to give an accurate generalized answer. 8 glasses a day? 64 ounces? 1 ounce approximately 30 milliliters. What is the most accurate generalized advice? Indirectly takes into account body size, composition, age, activity levels. Not helpful if you're unaware of your daily calorie needs. For average women approximately 2 L daily. For average man approximately 2.5 L daily. For performances, rehearsals, add 100 to 150 milliliters per hour. Account for fluid lost with expiration and physical exertion. Fluid timing. Body can only be hydrated to a certain extent. Different to food. Store now, use later. Excess fluid will simply be excreted. Common sense approach? Thirst mechanism is unreliable. When you feel thirst, already dehydrated. Thirst is satiated before complete hydration is achieved. Equals better to think of thirst as a warning system. For optimal hydration, drink little and often. Reflux. Gastroesophageal reflux disease, GERD, is an esophageal disorder characterized by symptoms associated with increased esophageal acid exposure. Also referred to as heartburn, indigestion. Reflux laryngitis is a vocal disorder that occurs due to irritation and swelling of the vocal folds as a result of the backflow of stomach fluids into the throat. Massively subject to inter-individual variability. Theme of this topic: potential culprits? Sugar. Linked with Barrett's esophagus, a condition in which the lining of the esophagus becomes damaged by acid reflux. Reducing intake may yield benefit. Alcohol. Somewhat conflicting results. Overall, the trend is a positive correlation between alcohol consumption and GERD symptoms, although the effect may vary substantially inter-individual. Less clear. Acidic drinks. Acidic fluids can reduce the pH of refluxed stomach contents and increase esophageal clearance time. In practice, many high-acid drinks have little to no effect on GERD, whereas certain low-acid drinks were associated with increased symptoms. Coffee can have a transient, passing effect on tone of the lower esophageal sphincter. Less effect has not been demonstrated in practice. No discernible association between coffee intake and GERD symptoms even with very high intake, and GT. 4 cups of coffee a day. Fatty foods delay gastric emptying. The largest population cohort study on the relationship between reflux and fatty foods, utilizing the National Health and Nutrition Examination survey of over 12,000 patients, found no correlation between dietary fat intake and GERD symptoms. Eating behaviors. Eating regular, smaller meals may be beneficial in reducing symptoms, particularly relate to the evening meals. Further to this, there is some evidence that sleeping on your left side may also potentially reduce symptoms. In a similar vein, lying with your head elevated may also be beneficial for symptoms. End of section. An introduction to laryngeal pathology. Natalie Watson. An introduction to laryngeal pathology. Natalie Watson, MAFRCS, ORLHNS. Vocal health first aid. Pathology. Small bump on vocal cord. General swelling. Inflammation. Infection. Vocal fold polyp. Vocal fold cyst. Vocal fold nodule. Granuloma. Not coming together. Muscle tension. Vocal cord palsy. Affecting the entire vocal cord. Spasmodic dysphonia. Benign. Recurrent respiratory papillomatosis. Pre-malignant. Erythroplakia, leukoplakia, malignant, cancer. General swelling. Inflammation, reflux, smoking, autoimmune. Remember joints, infection, viral. Bacterial, fungal. Reflux, dietary and AMP. Lifestyle changes. Hydration, review of medication. Elevation of head of bed. Diet and AMP. Dietary habits, fiber, fruit, veg. Exercise. Posture, breathing. Avoid. Reduce alcohol, caffeine intake. Lifestyle. Treatment of obesity. Explanation of voice mechanism and AMP. Spicy food. Avoidance of irritants. Smoking cessation. Strenuous exercise. Dysphonia. Voice use and AMP. Abuse, throat clearing. Stress, anxiety, anger management and AMP. Relaxation. Not coming together. Muscle tension. Vocal cord palsy. Presbyphonia. Muscle tension. Vocal cord palsy. Presbyphonia. Muscle tension dysphonia. Common. Underdiagnosed. Primary. Can occur with or without VF lesion. e.g. vocal fry, speaking voice, 95% of voice, bad behaviors. Engaging strap muscles, tongue base, palate, trapezius. Laryngeal massage, head and neck massage, kinetic chain, SLT. Secondary. Related to VF lesion. Treat underlying cause, physio, SLT. Muscle. Tension dysphonia. Small bump on vocal cord. Vocal fold polyp. Vocal fold cyst. Vocal fold nodule. Granuloma. Vocal fold mucosal irritation. Vocal fold mucosa edema. Huskiness, dysphonia, and AMP. Vocal struggle. Vocal fold polyps. Variably used term. Vascular polyp. Look out for a feeding vessel, ectatic vessels. Translucent, blister, fibrous mass. Respond to therapy, surgery. Opening parenthesis. Vascular harder to improve with SLT. Vocal fold hemorrhage, bleed. Voice abuse, sudden change in voice, wake up day after show with no voice. Stress, strain on mucosa, neovascularization. Across surface of VF. Neovascularization. Fragile. Within mucosa rather than surface. Tracking of blood. Resolution in most with no permanent sequelae. Inflammatory response associated with bleed. Total voice rest, 1 week, plus or minus steroid, may delay healing. Vocal fold cyst, P in a pod. Appear deeper they are still in SLP. Within the substance of VF. More likely to alter mucosal wave absent. In location of cyst, may be only. Hint. Sulcus? Desquamated debris? Question mark. VF cholesteatoma? Tear and entrapment of debris. Constant trauma gland may transport into this area. More likely to need surgery. Excise the wall. Longer recovery time. Vocal fold cysts. Vocal fold nodules. General bilateral. Striking zone. Junction anterior and middle third of. Membranous vocal fold. Callus. Thickening of basement membrane zone. Can repair with therapy alone, changing behavior. Vocal fold nodules. End of section. Building intuition and AMP. Listening skills. Chris Johnson. Building intuition and AMP. Listening skills. Putting your assessments together. Vocal health first aid. Recap. Adding to the story. History plus singing assessment. Compensations and maladaptions. Movement Series 1 head. Movement Series 2 arms. Movum. Ant Series 3 stability and AMP. Energy. Ellipsis 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 ellipsis. Vocal assessment. Movement protocol. Tongue and AMP. Jaw. Move head. Rolling shoulders. Arms in the air. Shake fist, run arms, sway body, march. The scores. Compare with original singing. Discuss and share thoughts. Reassure singer. Are they just warmer? Build your assessment. Flexibility allowed. Build your intuition. It's a numbers game. Exclamation mark. Moving forward. Assessments double as treatments. Positive. Include in vocal regimen in combination with voiced exercises. Quality of the movement. Negative. Still potential, but tread with care. Maladaptive tension arises out of the effort the task demands. One can't simply say, relax that, without first determining why the effort is called for. Lead a Skurs, the Manual of Singing. Voice Rehabilitation. End of section. An Introduction to Straw Phonation. Oren Boder. An Introduction to Straw Phonation. 3 highly effective SOVT exercises to maintain vocal health. Vocal health. First aid. What does SOVT mean? It's an elaborate way of saying that the mouth is partially closed. This partial occlusion allows air, pressure and acoustic energy to be reflected backward from the lips, decompressing and helping the vocal folds vibrate more easily, and with less muscular effort. Also known as back pressure. Back pressure is good for the voice. SOVT interventions offer so many benefits. Helps you to sing with ease. Helps you to strengthen your voice. Provides a protective, air cushion. Efficient vibration of vocal folds. Gain vocal power without straining. Recover tired and fatigued voices. Straw size matters. Length and diameter are vital in determining how well the straw will work. Easiest rules to remember are that narrow diameter equals greater back pressure. Longer straw equals greater back pressure. Using a really narrow, long straw will make the task more athletic. For a more therapeutic application, consider a shorter, wider configuration. One size does not fit all. Everyone is anatomically unique, individual. Differences make a huge difference, so you need to play about with straw length and diameter to suit the individual and to find a comfortable back pressure sensation. 2 types of straw. Technique. Pure straw technique. Pure straw just uses the mechanical properties of the straw itself to generate resistance. This provides a consistent, steady stream of back pressure. Good for training the VFs to sustain movement. 2 types of straw. Technique. Water resistive technique. Water resistive technique uses the weight of water as a variable resistance mechanism. This provides an alternating wave of back pressure. More of an internal massage-like effect. Recommendations. Look out for the icons. For the following exercises, if you see the straw plus bottle combo, we recommend using water resistive technique. If you see the straw alone, we recommend using the pure straw technique. Exercise 1. Unvoiced breathing drills. Helps to decompress the vocal folds. Helps to passively find and engage core. Connects the body to the breath. Exercise 2. Voiced, unvoiced. Switching. Switching between voiced and unvoiced sounds is a super good way to encourage the VFs to efficiently vibrate. Helps lower phonation threshold pressure. Gently massages across both conditions. Switch it up. Both EX1 and EX2 can be modified to suit. Play about with speed. Slower equals easier for the VFs and is more therapeutic. Faster equals more athletic, gym-style workout. Play about with patterns. Mix up the order of the bursts and sustains. Play around with how many of each. Exercise 3. OR. Hills and accents. Glide up and down your range, making sure to stretch a little higher, lower each time. Great for stretching the voice and exploring pitches in a safe way. Really play about and explore your range with this one. Accent equals a rise or fall in pitch or loudness. Hills equals consecutive accents that explore progressively higher, lower pitches. Bonus. Single notes. Working single notes at a time are a super way to check that everything is working properly. Focus on the airflow and breath. Ensure that air is coming out of the straw consistently. Bonus. Single notes. Sustain a gentle hum whilst blowing bubbles. Make sure the airflow is steady and consistent. Can be done with or without a piano. Be mindful of how everything feels.
End of section. $% and asterisk plus. $% and asterisk plus. Increased CV health. Increased muscular strength, including sarcopenia and ARS. Increased bone density. Improvements to hormonal and metabolic profile. Weight management. $0 plus $1 asterisk plus $234.51 $3.06 asterisk $4.7 plus asterisk 0.538. All previous benefits listed are useful. Asterisk plus. Increased immune health. Improved sleep. New-ish research. Greater CV fitness equals faster vocal recovery time. Improvement of functional task abilities. 9 plus, 0.5. 41.5 plus. 1, 2, 3, 4, 5, 67,050 feet. 8 feet 95. An asterisk less than equals plus, percent hash plus asterisk greater than dollar, asterisk, at percent, asterisk hash, AB, percent and CB dollar and div, dollar percent, CB dollar and DF, percent, D, B sharp, N asterisk plus and AD hash G percent asterisk hash and I percent hash DB plus G hash equals and J and plus J dollar percent and at percent hash dollar percent and hash dollar and asterisk plus hash and percent and hash percent. OB sharp 3 plus at less than JD D at I percent dollar K plus equals B hashtag B plus B dollar asterisk percent asterisk less than hash asterisk per percent hash plus equals B asterisk hash asterisk plus and G asterisk hash dollar percent 0 and percent 1 foot asterisk 2 plus 3 plus hash 4 plus and 5 and plus and 4 equals asterisk hashtag B plus equals L percent equals B 3 inches greater than H percent I percent ABD 3 at JH percent hashtag D at $J 3 feet K dollar asterisk in B 6 inches plus $1 asterisk BJ asterisk and hash less than B plus equals $BJ less than equals plus equals $BD 9 asterisk hash percent asterisk percent and hashtag it plus 8 hash percent and B less than I 0.1 feet 51 asterisk $38 1 2 feet 51 plus N $B J plus B sharp asterisk M IG B dollar at $OB hash. Any exercise or exercise plan can be deleterious if not executed properly. Follow a structured plan and learn how to perform exercises properly. Caution! Singers and voice actors have considerations and certain needs beyond the knowledge base of your average personal trainer. A few things to look out for. 0.1 feet 51 asterisk $38 1 2 feet 51 plus 9% plus asterisk less than J. Performing, rehearsing, singing is neurologically demanding, often underestimated. Single battery for whole system. Training intensity. Never be sore from workouts. Benefit. Fatigue balance. Training timing. Never let your performance suffer. Exercise should enhance life, not detract. 0.1 feet 51 asterisk $38 1 2 feet 51 plus OJ J in percent dollar 7 AJ percent and percent hash. Exercise can and will change your body. This is normally the point. Issues will arise from improper form, improper exercise selection, normally too much push, not enough pull. Common misconception. Issues are as likely to arise due to CV. Exercise, e.g., running, as they are from weights. Gym exercises can and should be corrective. 5p, 6 minus 5 feet 74, QR, 8, 54, S50T, $L, asterisk, greater than, percent, M, 3, at percent do, $, less than asterisk D, $, plus J, percent at DBH hashtag J, and asterisk M, and I, J at B plus asterisk H percent and B $, AB, percent and $BDJ, plus B sharp, E at $, plus equals asterisk hash less than F. 7 asterisk 8% hash 1 foot B, plus equals $, plus J, percent at DBH hashtag J, asterisk, J $, and I, percent, J hash, plus B sharp, B, plus equals, percent HBJ hash plus B, percent D, B, E, percent plus F, plus asterisk, J, $, hash plus K, less than A, hashtag B, hashtag D per percent plus B sharp, percent, plus B, plus equals, plus asterisk less than equals plus hash, the $, asterisk less than asterisk D plus I, plus equals, HJ, and $, plus J, percent at DBH hashtag J, BA, $, D asterisk plus equals asterisk, M, $, and percent I, $, B, percent D, B, plus asterisk, J, asterisk, HB $, and asterisk M, and I, plus B, at $, asterisk less than asterisk DV plus asterisk less than equals plus W asterisk, X greater than